Assalamualaikum warahmatullahi wabarakatuh. Your Excellency, the lecturer of EAP, Muhammadiyah University of Surakarta, Mr. Ahmad Fauzi Jamaluddin, unforgettable, all my friends whom I love. Today, we want to present about common illness. So we decide the topic is flu. Before that, we want to introduce ourselves. Start from Dimar.
My name is Dimar Pitra Rinonce, and my student ID number J500210104. Thank you.
Next, Umaro.
Okay, my name is Rahmandani Umaro Ihsan. My study number is 50021011.
Next, Reydovan.
I'm Reydovan Putra, and my student ID number J500210116.
I am Adhysta Mangkuluhur. Study ID number G500210117. Next, Firzha.
I'm Firzha Sadewa, and my student ID number is J500210119.
Next, Euclida.
I'm Rahman. My study ID number G500210120.
So today we will discuss about flu, start from introduction, cause, symptoms, treatment, and prevention. The first is introduction. Influenza is an infectious respiratory disease. In humans, it is caused by influenza A or genus influenza virus A and influenza B, genus influenza virus B, virus or influenza virus C and influenza virus D genera are also known. Symptoms associated with influenza virus infection vary from a mild respiratory disease, confined to the upper respiratory tract and characterized by fever, sore throat, runny nose, cough, headache, muscle pain, and fatigue. To severe and in some cases lethal pneumonia owing to influenza virus or secondary bacterial infection of the lower respiratory tract. The WHO or WHO estimates that annual epidemics of influenza result in 1 billion infection, 3 until 5 million cases of severe illness, and 300,000 until 500,000 deaths. The severity of pandemic influenza depends on multiple factors, including the virulence of the pandemic virus strain and the level of pre-existing immunity.
Causes. Influenza. The major burden of the disease in humans is caused by the seasonal epidemic of influenza A and influenza B viruses, with most of the infection occurring in children, although most of the severe cases involve very young and elderly individuals. Seasonal influenza H1N1 and H3N2 currently circulate in humans, but influenza A, H2N2 viruses were the only human circulating influenza A viruses from 1957 to 1968. Before 1918, conclusive evidence of circulating subtypes is not available. In addition to seasonal epidemic, the introduction of influenza A viruses from either avian or swine population has led to 4 pandemics since 1918, with those viruses subsequently becoming seasonal epidemic strains in subsequent years.
Okay. Influenza A and B. The figure represent an influenza A virus particle or virion. Both influenza A and influenza B viruses are enveloped negative sense RNA viruses with genomes comprising 8 single-stranded RNA segments located inside the virus particle. Although antigenically different, the viral protein encoded by the viral genome of influenza A and influenza B viruses have similar function. The 3 largest RNA segments encode the 3 subunits of the viral RNA-dependent RNA polymerase, or PB1, PB2, and PA, that are responsible for RNA synthesis and replication in infected cells. 2 RNA segments encode the viral glycoproteins, hemagglutinin or HA, which has a stalk domain and a head domain, which mediates binding to salicylic acid containing receptor and viral entry. The neuraminidase or NA, which is responsible for releasing viruses bound to non-function receptor and helping viral spread.
Okay, the symptoms of influenza. A diagnosis of influenza is made mostly on the basis of clinical presentation and epidemiological likelihood of infection. Initially, non-specific symptoms predominate, including fever, chills, or frank shaking, headaches, myalgia or muscle pain, malaise or discomfort, and anorexia. The onset of these symptoms is sudden, and respiratory symptoms, particularly a dry cough, sore or dry throat, possibly with hoarseness, and nasal obstruction and discharge are usually also present. Cough is the most frequent respiratory symptom and can be accompanied by substernal discomfort or burning.
Adjustment. The United States Authority on Disease Prevention, the Center for Disease Control and Prevention, CDC, recommend that persons suffering from influenza infection 1. Stay at home. 2. Get plenty of rest. 3. Drink a lot of liquids. 4. Do not smoke or drink alcohol. 5. Consider over-the-counter medication to relieve flu symptoms. 6. Consult a physician early on for best possible treatment. 7. Remain alert for emergency warning signs. Influenza, the United Statement, antiviral medicines are an important tool in both controlling influenza by treating the patient infection and helping to prevent severe illness that can result from flu, including bacterial pneumonia. When taken promptly, antiviral drugs can reduce the severity of the flu-like symptoms and can shorten the length of the illness by an average of 1 day. Taking antiviral drug early is especially especially important for people who are at high risk for flu complication, such as the elderly or people with compromised immune system.
Okay. Prevention. Clean and disinfect surface and objects that may be contaminated with virus that cause flu. Cover coughs and sneeze. Wash your hands often with soap and water. Avoid close contact with people who are sick.
That's all for us. Thank you very much for listening our beautiful presentation. Forgive us. We did many mistakes. We are just human beings. Wassalamualaikum warahmatullahi wabarakatuh.